making sure that he actually came and delivered this speech. Thank you. Now, my colleagues have talked to you about the therapeutic processes in relation to ACT, but I'd like to just give you a summary from a review by Ruiz in 2011. The main therapeutic approach in ACT is to uncover the areas and values that are deemed to be important by the individual, and then developing actions that are in connection with these values. And in the presence of negative inner processes, the intention is to encourage cognitive diffusion that would hopefully foster meaningful living. That's the main therapeutic approach of ACT. Now, in psychopathology-associated cases, these are actually the studies that have been conducted. You see the list. And from this list, I'm going to talk about smoking, diabetes, obesity, and craving and cancer. I'm rather going to refer to a number of studies conducted in these areas. Now, this is one on sweet craving. It's a randomized controlled trial. It's in a comparison of acceptance and control-based strategy, two strategies for coping with these cravings. 48 patients were enrolled. It was a single day, 2-hour session. And after that session, they were asked to carry a bar of chocolate for 72 hours, which can be considered as a stimulant for them, but they are told not to eat the chocolate, but they have the right to buy chocolate from elsewhere. Now, the scoring here is called power of food scoring. So the individual's sensitivity towards sweet stimulants. There are 3 categories. In high sensitivity group or obese patients, ACT has an impact on consumption and sweet cravings. It's quite effective. Another study was about mindfulness and acceptance-based workshop. It targeted obesity-related stigma and psychological distress. And this kind of an intervention is compared with a waiting list. It's a 6-hour workshop with a 3-month follow-up, and it was shown that obesity-related stigma was reduced, quality of life was improved, and also psychological distress was improved. And although no direct intervention was made, there was a significant reduction in the BMI index in the ACT group. Now, when you look at the mediational analysis, you see that it was weight-specific acceptance, coping, and health-related values. Again, another study by Tapper and his friends and his colleagues was a direct intervention, this time to weight loss. 62 women patients were involved with a mean BMI of 37.2 kilograms per square meter. Physical activity and the reduction in BMI were more marked in the ACT group. Now, briefly, ACT defines obesity as, or it rather says, that the behavior to control eating results in a marked weight increase. And emotional eating is, of course, the main behavioral avoidance strategy in face of negative life events. Following obesity surgery, in about 2 years, 20 to 30% of the patients patients, or rather patients put back on 30% of the weight that's been lost. Now, in this study, a routine treatment group and ACT group were compared. And significant improvement was recorded on eating levels. Another study this time around on diabetes. It involves acceptance and mindfulness skills to difficult diabetes-related thoughts and feelings, and the other group was only receiving psychoeducation. In HbA1c and better diabetes self-care, there has been a significant improvement, and acceptance of the disease and value activation have been demonstrated to be important. Another study this time around from Iran with a fewer number of patients, 24 patients. It consisted of 10 sessions of 2 hours. ACT was compared with a control group. And here they focused on insulin usage, physical activity, so diabetes-related self-care. The ACT group received additional benefits. Another study about smoking cessation. Pharmacological treatment was compared to ACT. Under ACT group, the main treatment approach is as follows. You have interpersonal context and support, and it reinforces the development of acceptance-related skills. The support provided in a therapy setting is also under this heading of interpersonal context. The second intervention has to do with self-discrimination skills and identifying the aspects of their experience that have previously occasioned unhealthy behavior. So this is basically mindfulness work. And then at the third step, we have guided exposure to previously avoided internal experiences with response prevention. And the fourth stage is constructive behavioral activation. There are 2 randomized controlled trials that were conducted in relation to cancer. Terminal stage cancer patients were studied, and 12 sessions were applied to patients. The fear of relapse was lower in the ACT group compared to CBT. Again, another study this time around from breast cancer, with patients with relapse risk were enrolled, and in the ACT group, these concerns were significantly reduced, compared to the waiting list. This is a study focusing on epilepsy patients. And the interventions towards behavior avoidance in relation to the disease led to significant improvements in epilepsy seizures and quality of life 12 months after the interventions. This is another epilepsy study by the same group. ACT was compared to yoga rituals, and interestingly enough, in both, they both led to reduced seizures, but in ACT actually reduced the seizure index significantly more compared to yoga. And Ruiz published his review in 2010, and it shows the effectiveness of ACT in psychopathological cases. So thank you.